at 7 a.m.
It is now 7:20. While doctors regularly screen for conditions like diabetes, heart disease, and cancer, eye health can sometimes be forgotten, and that's why knowing the warning signs is really important. Dr. Joshua Groetsch with People's Health joins us this morning to help show us what the signs are to look for. Good morning.
Good morning.
Well, this is a really important issue. I mean, your eyesight is so important.
Yes.
You just can't even imagine having to go through life on a daily basis to deal with, without your sight. So we're talking about glaucoma. Exactly what is it?
Well, glaucoma is a disease of the eye, or a group of diseases of the eye, that slowly lead to damage to the optic nerve, which connects the eye to the brain. It's related usually to high pressure in the eye. And since the nerve connects the eye to the brain, if you're damaging that connection over time, it leads to significant vision loss. Okay. It's one of the leading causes of blindness in the world. Not good.
So what are some of the things that leads to this? And is it one particular age group?
It's a disease of aging. Over time, obviously as you get older, everyone gets older. You see spikes in its incidence when you hit the age of 40 and then again above the age of 60. There's a race correlation there. African Americans are more commonly affected than any other race. And then there's a genetic predisposition. So if your family members have glaucoma, you're at high risk for glaucoma yourself and should get checked. If you've been on steroids or other medications, if you have diabetes or other medical conditions, there's a risk that you could get glaucoma.
Well, let's talk about what are the signs that you do have something serious like.
Well, the most common sign is vision loss, or in particular loss of peripheral vision over time. Unfortunately, because it affects your peripheral vision, most people won't notice a slow loss of the peripheral vision over time. So more often than not, you find it's asymptomatic. People just don't realize it's going on, so that makes it important to get screened for it on a regular basis to ensure that if you do have it, you catch it early and you don't have significant vision loss from it. There are rare forms of glaucoma where you can have a sudden development of high pressure. Usually this is a very slowly developing process over time, but sudden increases in your eye pressure will lead to things that you hear about, such as pain, redness in the eye, sudden loss of vision, halos around lights, even a headache with nausea or vomiting. But that's not, and although obviously all those signs are things you should get checked out about with your eye doctor, it's not something that will most commonly be your presenting symptom of glaucoma.
But I mean, visually in your eye, you can't look in the mirror and see it.
Visually, you don't see it. You don't know. Most people say, oh, I don't have a headache. I don't know. My eye's not hurting. And unfortunately, the pressures that usually lead to damage don't lead to any physical signs. So just looking or waiting for sensation, usually you won't feel it.
So in that case, then, what age would you suggest to start getting your eyes checked?
Generally recommend, regular eye exams throughout your life is always good, but in particular once you hit the age of 40, every couple of years, assuming everything else is always checked out okay, you should get checked. And then once you hit above the age of 60, at least every year you should get your eyes examined.
Are there things you can do along the way to prevent it?
Preventing it, screening is number one. Watching, if you have diabetes, watching your diabetic control of your eye pressure. If you do have documented problems with your eye pressure, you want to make sure you're using your medications properly or following up to make sure that pressure is staying controlled. Preventing use of medicines, if possible, that may increase your risk. And trauma, I didn't mention trauma before, but any traumatic injuries to your eyes put you at a higher risk, so avoiding trauma to the eyes, obviously.
When you're a kid, your parents always say, eat carrots, it's good for your eyes. Is that myth?
That is true. So there's lots of minerals in carrots and other vegetables out there that protect your eyes, and particularly the retinal tissue of the eye is where you see a lot of the benefits there.
So there are some things that you specifically eat?
Yes. But, well, there's some things that you particularly eat, but that's more protecting your retinal health, not so much the glaucoma. Obviously, diet control or dietary habits are good for health overall, so it will help your eye health overall if you eat the right stuff.
Any little thing, but bottom line, get a screening.
Yes.